Yeah, hi. Thank you everybody for taking the time today to hear about what's happening with kids. I just want to make sure everybody knows that in addition to the nice introduction that Alex gave about us being the region's child advocacy organization for kids in the region, some of you may have known us as Public Citizens for Children and Youth. A little over a year ago or so, we changed our name, but if you're like, who's Children First? I don't remember that. And you know PCCY, that's who we are. So every 2 years, we put out basically what we call a status report on children in each of the 5 counties. What we're talking about today is the status report that we released in August on children in Philadelphia post-COVID. Yesterday, we released the same different data, same framework report for children in Delaware County. And on Monday, we released the report for Montgomery County. And next week, we'll be doing Bucks County. So basically, what we try to do is sort of give a snapshot of where kids are. In our last series, which was underwater, we found that nearly half of the families in Philadelphia were underwater, meaning their incomes were too low in 2018 to meet the needs of raising children. And so while our poverty rate is high, even working class families had a really hard time affording what it took to raise their children. Now the pandemic struck, and the pandemic really put extraordinary strain on the systems that serve children. But one of the things that we found in the pandemic, and I hope you can see my screen, I would do this as a slideshow, but I found yesterday it didn't actually work. I'm going to share it as a slideshow so you can see the list. But nevertheless, the most important thing that we found looking at the data is that good public policy really worked during COVID. Now, first of all, we know the vaccine was in itself an evidence of good public policy. But as it relates to kids specifically, good federal policy and working with good state partners really expanded the safety net for children, kept children fed, kept them healthy, and kept them from being in poverty. So you'll hear some startling data here about those figures and how dramatic that was, but it does show that we do know how to do things. It's really a question of setting our minds to it. Now, the city and the school district really stepped up in Philadelphia. I have to say, the mayor, the Office of Children and Families, the superintendent, the school district staff, we know that shuttering schools in March 2020 was a shock to the economy and a shock to our systems. And, you know, a lot of places in the country were not as fortunate. There were lots of problems in Philly, but the city did set up access centers where kids who were home alone could go. Could have done it better, but they did it and kids were there. The school district moved out 7.7 million meals to kids in their homes. 50,000 computers were purchased in a matter of 6 weeks. Fortunately, the school district did it because other districts took longer and there were no computers to buy. 82,000 laptops were distributed. 19,000 kids, especially with the help of Comcast, got access to the internet through hotspots. And PHL Connected, which was to help families who didn't know how to connect to school on the internet, got help through Philly Connect. So like these are infrastructure that were created, and it's really good to call out when people do things right. There was a lot of frustration. We were meeting with the city regularly, as were many organizations, asking them to do more. But remember, the city itself was suffering with staff who had COVID, staff who died, same with the school district, and people who couldn't go to work because they had family members who were immunocompromised. So everybody was in disarray, but Philly actually did do some pretty strong work to protect kids. Now, in spite of that, let me just say, we see that we know that it didn't all work well. Even when kids got laptops, even when teachers were trained, 4 out of 10 teachers are saying their kids had technology challenges. And sadly, when we closed in March, we started virtual participation in May. We had to get the laptops, etc. And in the first week, it seemed like it was really going to work. 8 out of 10 kids were participating, and 4 weeks later, now it was in June, which is the end of school, half of the kids were participating. So it showed that the initial work of virtual learning did not really resonate with children. they were not feeling that they could really learn well in that setting. And it's no surprise that a year later, when the district looked at its reading scores and the reading scores that compared 2021 last fall to the fall of 2020, the fall when COVID was hitting, that we saw loss in reading in capacity. And we really saw that in 2nd to 6th graders. Now, we don't know why the the kindergarten and the 1st grade kids did not seem to be as hit by the impact of remote learning in the fall of 2020 as the kids in the upper grades. Some of it may have been kids were in pre-K for the kindergartners, so they were still going in person. Lots of childcare in pre-K was still in person. And maybe it's because the 1st grade teachers in Philly were better than the 2nd, 3rd, and 4th, and 5th, 6th grade teachers, who knows? But we have some early warning signs that our kids lost ground in reading. Now, these are early warning signs. These are the district's assessments. We're going to learn a lot more when the PSSAs come out. They'll be coming out very soon. What we know is everybody lost ground. Every school, I shouldn't say everybody, but every school district lost ground. Philadelphia students will be reporting very disappointing results. We should expect that. It will be happening across the country. But what we know is that what we are likely to see is that the 3rd grade PSSAs are going to look very depressing. And we also know from this data that the Ames wave data looks depressing. And for Read by 4th, this is a huge issue because the school district has some options on how to solve this. And we really need to be thinking about those options. And I'll come back to that in a little bit. Parents also found it very hard to help their children during COVID. This parent, Serjaz Carr Watson, was one of many parents we talked to during COVID. And he was like, I'm not a teacher. My ability to make sure my kid was equipped to learn at home wasn't so easy. And this is the sentiment that parents felt. And when we talked to parents across the region, it was really hard to keep your kids on task. So we had this notion we could do virtual learning, even where parents were totally attentive, and many of you may have been those parents too, it wasn't so easy. Now, against the backdrop of lost learning, Philly lost a lot of adults. Over 5,000 people died. One student, 17-year-old student, but 5,000 adults died. Parents, grandparents, uncles, aunts, cousins, older siblings. Our children were mourning during this. They were mourning because they lost family members. They were anxious that their parents were going to get sick with COVID and die, and they were isolated because school was going to shut down. And so what we found was pretty alarming data about the mental health of kids. Now, some of you may know we have something called the Safe to Say hotline. It's really intended for kids to call if they're being bullied. Like, I'm being bullied at school, can you help me? That's the point of that hotline. But kids can talk about other things on that hotline. And we just looked at the ones that were the most serious, and that being attempting suicide or self-harm. And across the state, the calls for those reasons rose by 34%. But in Philly, they rose by 46%. I'm sorry, I'm giving you the wrong data. I'm giving you safe. I want to go down to Safe to Say, what I'm talking about. My apologies. I thought that number was wrong. Across the state, the calls to the state hotline for self-harm or attempted suicide rose by 18%. But in Philly, they rose at 3.5 times at 62%. Now, look, this isn't a lot of calls. This is a hotline that is very underknown. You know, you hear about it in school from posters. But it resonates with us because it also mirrors what CHOP told us they were seeing in their ERs of kids coming in with attempted suicide spikes and across the country. So the impact of COVID emotionally was very big on our students, very big. And we're going to come back to that. But we also have to think about what was happening with the health of our kids. Now, Philly parents did a very good job compared to the rest of the state vaccinating their children. So this is the data I was showing you before. 46% of our kids, as of last June that just happened, June 2022, were vaccinated compared to 34% across the state. But it still means that a majority of kids in Philly are not vaccinated who can be. And it's about 400,000 kids, right? That's an awful lot of kids. And what we see is that most of the risk of COVID exposure falls in African-American kids and white kids, because they're the majority of kids in the city. But the disproportionate number of Black kids not vaccinated is very troubling. And it really shows that we have a lot of work to do to break through on persuading parents that the vaccinations are safe and need to be done. Yesterday, as we rolled out, on Monday, as we rolled out the Montgomery County report, we had a student from Norristown speaking with us on that press conference, and she herself had had COVID 2 weeks before and was very sick in spite of having been vaccinated. And fortunately, she was vaccinated. But COVID is still going around, and there are far too many kids not vaccinated. And I'll tell you, we also have more kids enrolling in school with provisional inoculations, meaning they aren't getting rubella, measles, chickenpox, mumps, polio in Philly, because the anti-vax messaging that was used to attack the COVID vaccination penetrated to parents on deeper levels about the safety of vaccines in general. And we're seeing in Philadelphia, Delaware County, Bucks, and Chester, a rise in the number of kids who are going to school provisionally still needing vaccinations. So this is an area that we all need to think about. So that's sort of like, you know, there's some real big takeaways: mental anguish, not enough kids vaccinated, and but you know, Philly did better than the rest of the state. There's one thing that really jumped out at us is going in the other direction. So what I gave you was kind of like negative news, right? But this is pretty much of a shocker. Philadelphia's child poverty rate dropped by 15%. Now, given that we have some of the highest child poverty in the country, any drop in the child poverty rate is good news. But going from 31.6 to 27% in a period of economic shutdown and national crisis really stunned us, And this was a pattern we saw across the counties. And the reason that this happened when we looked into the data was the incredible power of the child tax credit. The US Congress, under the American Rescue Act and the CARES Act, really increased what was available for families in terms of income. And they did so at not a meager level, but a really substantial level. And it resulted in fewer children being raised in poverty during COVID. Now, that enhanced child tax credit sunset in December 2021. And so we're likely in 2022, without congressional action, which could still happen, to see that child poverty rate go back up. But in fact, this was extraordinarily news, and it goes back to the point that good public policy worked. In fact, there are 3 pieces of public policy that work in tandem. We also had flexibility in Medicaid, so that if parents lost their health insurance, kids could rapidly be enrolled in Medicaid and keep their Medicaid for the duration of the pandemic. 26,000 more kids in Philly were enrolled in Medicaid, could go to healthcare, right? Could get their healthcare needs met. 172,000 kids in Philly benefited from SNAP. And as you know, not only was SNAP critical to families who lost their jobs, but it was the way that a lot of kids got summer meals, because their SNAP benefits were turned into summer meal resources as well. And 6,200 kids in Philly were added to the SNAP program. And then 169,000 families got that child tax credit, which was the biggest mover on why we had fewer children in poverty. Good public policy works. We know how to do it. Thankfully, we did. Just to give you a sense in Philly of who signed up for Medicaid, how it looks demographically. So right now, 3 out of 4 children enrolled in Medicaid in Philly are African American. There's a type of the kids who enrolled. This is 26,000 kids enrolled. 3 out of 4 out of those who enrolled, newly enrolled, are African American. The pie chart is what it looks like right now in general in Philadelphia of the kids enrolled in Medicaid. So that's good public policy. But meanwhile, as the economy tanked and things were shuttered, our childcare sector really took a hit. Now for Read by Fourth, this is important because those 0 to 5 years when kids are in infant toddler care, pre-K for 2 years, high quality childcare, this is where we're developing those fundamental skills needed for early reading success, right? And so 12,000 fewer kids are in childcare today compared to when COVID hit. And that means those kids aren't likely to be in settings that are doing that extraordinarily important developmental work, right? That's a real problem for the incoming cohort of the Philadelphia School District, right? So we have kids coming in likely to be less prepared. No guarantee, maybe their parent wasn't working and they were doing that work with them, but we know that the most reliable way for working parents to get the support is a really functioning childcare system. So why are there fewer kids in childcare, right? Especially now that the economy's rebounded. We have rebounded in terms of numbers of businesses, we've rebounded in terms of employment, but we haven't rebounded yet in terms of women in the labor force. And a lot of it is because of the shrinking availability of childcare. Now, why do we have less childcare? Well, in Philadelphia, if you were going to go get a job in childcare, you would be doing so at a personal cost because you could go work at Target for 19% more than you would be earning in a childcare center. Yes, I said that. People in a pre-K program have a bachelor's degree and they are getting paid less than what they would get paid if they went to go work at Target. And so what you can see on the far side of this graph is even a greater divergence where retail wages are going up and childcare wages are really getting more and more divergent from retail. This is a troubling sign for the childcare sector. Our childcare supply in Philadelphia has shrunk by 33%. So that's why, like it or not, we see fewer women in the workforce. And this is not going to be solved until we can solve this childcare crisis. Now, the Rescue Act and the state put money on the table to try and keep childcare centers open, to try and resolve some of these wage issues, but it hasn't been done in a way that's systemic enough to cause childcare centers to be able to raise their wages for all their employees, bring in workers and sustain those wages, and not increase tuition for families. And so we have this juggernaut that's hard on families, but it's also going to be really hard on early literacy skills. So we have to attend to this. And that takes me to the final thing that we found during COVID. Some of this is like, just a refresher for us in Philadelphia. This is, what we're looking at here is districts across the region. On the left-hand side, you see Radnor. Radnor has 80% of its kids testing at grade level, and it has about 10% of its kids in poverty. Philadelphia, pre-COVID, had a little bit less than 30% of its kids testing on grade level, and it has a little bit less than 80% of its kids in poverty. So pre-COVID, our kids weren't doing well. This is the snapshot pre-COVID, right? And so the question that raises is, if that's where they were before COVID, and based on the data I told you about the district's assessment, where are they going to be now that we're really back in school for the first time for a full year in person? Well, one of the things we know that's going to constrain our ability to respond to how far kids are behind is the fact that at the same time, Philly has a high poverty rate and low performance. It also, of all the 61 school districts in our region, our 5-county region, has the least amount of funds to spend to educate its kids. So Radnor, as I pointed out, have nearly all its kids testing on grade level. Well, they have $10,000 more kids. We have 30 kids in our classroom, so that's $300,000 per classroom more than we have in Philadelphia to educate their students. And so, this is going to hamper how Philadelphia can go about helping its kids catch up. Very quickly, I want to tell you we have 5 recommendations. The first recommendation is that Philadelphia did a great job during COVID, but we need to be ready. This is not the only public health emergency we're going to face. Philly has to document what it did, convene people and get the lessons learned, especially the lessons learned around equity as it relates to kids during the crisis, and put together its structure and plan for how it will do better next time to watch out for children in a crisis. We cannot wait for the next crisis to really develop the infrastructure and the templates and the plans, because we've got to do much better for kids next time. They suffered terribly. The second thing is we have to invest in kids. Now, many of you on this call know the state legislature put $1 billion into schools last June. Philadelphia got about $300 million, which is spectacular. And hopefully that money will be recurring. And they also got a couple $100 million in federal funds to help build and support students to catch up and learn. And so one of our questions needs to be, what is Philly doing with the resources to make sure the school district is doing everything it can to help our kids catch up? I still think that's an open question. And we have a new superintendent that question really needs to be asked of. Not that people aren't working hard, but are we working as smart as we can be? And then the second is $300 million in Philadelphia doesn't begin to close the gap between Philadelphia and Radnor. And so we need to not just solve for catching kids up, but in general, given how bad we were before that, we need to bring all of our kids up with sustainable resources and better practices. We also know our kids are suffering with mental health. Now in Philadelphia, the school district has a terrific partnership with community behavioral health to create intensive behavioral health services in our school and intervention services for kids who are dealing with anxiety and depression. But that was all rolling out just as COVID struck. And there were huge bumps in the road. And there is a lot of work to do with the city, community behavioral health, the school district, and the mental health infrastructure to make sure that the full spectrum of behavioral health supports our kids need to not just recover from COVID, but the trauma of living in this city with gun violence, the sadness of losing my parents, feeling like I'm behind in school. We need to really make sure we do much better and build on what was started during COVID. Obviously, we have a childcare crisis. There's a $380 billion childcare bill being held up by the US Senate. That's critical to solving that childcare crisis, because not only does that bill put money on the table, but it requires the federal and the state government to partner to make sure childcare staff are paid enough so that they can work in this profession. That's going to open up childcare slots and increase childcare affordability for families. I will say the state put a lot of money into pre-K when it passed the budget as well, $70 million. So we're making some progress on access, but there's a lot more we need to do to still recover from the impact of COVID on the childcare sector. And then lastly, I told you we dropped poverty. Child poverty dropped in this city remarkably during COVID. We cannot give up on the public policy that made that possible. Poverty can have a permanent impact on kids' brain development. And it certainly makes raising your children very difficult for parents, which makes it very difficult for children. And so we are really encouraging everybody in the city and the city leaders and the school district leaders to make sure that the US Senate, before the end of this year, reenacts the child tax credit. That can happen. I will say the US Congress is spending a lot of time talking about corporate tax cuts. And what we know is that if we lend voice to the children in this fight, we can get that connected with that corporate tax cut bill.